Well, welcome and good afternoon, good morning, and good evening, depending on where I have the pleasure in speaking with you today. We're excited to be here, and thanks for joining. This is one of our series, and it's Microsoft 365 and Project for all you healthcare folks out there. So we're going to be getting into some details, and very much happy that you're here for us. Hey, we have a great webinar in store for you today. We hope you can join us for some of our other webinars, and you'll see those in just a few minutes. My name is Jacques Goupil, and today we'll be taking a look at accelerating your digital transformation journey with Microsoft Project and Microsoft 365, obviously in the healthcare industry. So today's session is going to be recording, so if you want to go back and listen to this, go ahead. And if you are joining us from the recording and you won't need to submit any questions, you can do so through our YouTube channel or reach out to us directly at info@ppmworks.com. For those on the line, make sure you use the Q&A tab, and we'll be monitoring all questions and answering those as we go. We'll also have time at the end of the session, and we can do some question and answers there as well. Now, I tend to get a little excited and move kind of fast, so if you need me to slow down at any time, just go ahead and ask me, and we'll go ahead and revisit that. So my name is Jacques Goupil. Thanks for joining us. I am a director here at PPM Works. We've been around for about 20 years. Excited to bring our knowledge and our expertise in the area where we started, which was PMO and PPM solution development, and really transcending across what's today the space of digital transformation, as well as really getting that collaborative area out to organizations, especially in these times, getting your information out to people and having folks communicate and get that information back to you is definitely a key here. I am always looking for folks to reach out to, so if you want to link in with me, there is the LinkedIn address. You can just search my name. It is an unusual spelling, but Jacques Goupil, and I'll be happy to continue to link in, but also send information like this and other webinars that are coming your way. We do a lot within the community. I'm happy to be invited to many different organizations to speak, as well as some industry conferences today in this world. Most of them are, and not all of them, have been remote. And from my training past all the way into my fun on traveling around with my family, now that's sort of been curtailed, but we're looking forward, and we actually do have some Zoom sessions with grandparents that take us on journeys throughout the US and throughout the world, and it's been pretty darn creative. So again, thanks for joining us today. Now, as far as PPM Works, we're here to answer all your needs. We are a gold certified partner. That means we do have some access to some incentives that Microsoft provides us. We're talking about some of those workshops at the end of today's session. We also join them and do different offerings as well as some webcasts, and we'll talk about those in just a second. We are really here to serve you. A few of our healthcare industry recent history here, or experience I should say, has been noted down there on the bottom. We have been lucky to be a part of these organizations, especially as we're going through some of the virus and the different COVID vaccinations here. Well, the upcoming webinars, they are weekly, and if you are doing this recording, you'll find other recordings that are out there on our YouTube site, so go ahead and look for those. We're going to be going through an industry-specific one. That's what you joined us here today. So finance, retail, and some others that are coming down throughout the month of November. And then we've also have a success with the new project operations that's out there. So we're going to be going in there and taking a look at another tool called Project Operations. Well, folks, it is a tough time out here, and we like to begin by addressing that, it's consumed us, not only as an organization, but as a human race. We are dealing with and we're faced with incredible pressures. Healthcare organization has probably taken this the hardest, right? Increasing pressures, including demand for services, increased patient acuity and demand for new capabilities, some organizations have faced these challenges despite insufficient resources and even lacking basic protective equipment. I hear the stories all the time. I heard something on the news today, uh, the radio that is, and talking about both private and public um, long-term care facilities and how that has been impacted. From a healthcare worker perspective, already strained by the pandemic, we're also, falling ill to COVID. We have these constant pressures as well as exposure risks that are out there. So all these compounding challenges. How can we get healthcare organizations to support those healthcare workers and where they need it the most? Well, a lot of it's going to be getting access to clinical data, getting access to their patients, patient security, as well as both just the overall ability to communicate and effectively diagnose different things, whether that happens to be systemic process related issues or we're actually talking about the patient themselves. One answer to all this could be in around technology or Microsoft technology solutions, including Microsoft Project, Teams, Power Apps, which have all proven to be helpful and relevant in supporting healthcare workers. There's a bunch of stories here, and you're going to hear them directly. I'll go through a few that we have. But for example, dramatically reducing paperwork, allowing the frontline workers as well as healthcare professionals to directly spend time with their patients or spend time with what they're doing, whether that's research or clin or whatever it happens to be. Some of the clinical challenge that we're faced today is, I just mentioned it, doctors and other folks are constantly being inundated with, let's say paperwork or other things. It's pulling their attention away from what truly matters. So if we can help out in any direction there, that's what we're going to be doing. Some additional healthcare challenges that we're seeing when we go across the healthcare landscape in and around the COVID-19 disruption, is, the organizations are being squeezed. We have this plummeting revenue source, if you will. Elective surgeries are down. All these other things that are bringing money into these organizations, particularly around hospitals, are low, and we still have to deal with the crisis. So the costs are rising. So we have the income coming down, we have costs rising, canceling all this stuff is really having an impact on us. And that 70%, you can see, is the average amount that we're reducing. And we're talking directly about healthcare and hospital systems. They're all of our clients, they're bracing themselves for, unfortunately, what is looking like system-wide disruption. And we've seen anywhere from temporary layoffs to reassignments to pay cuts, ranging from anywhere from up to 75%, which is not good. So how can we help this? Margins. You can hear this in any industry, but specifically, we have such thin margins that, again, we're feeling the pressure because the small amount of cash on hand that we have, we might not be able to do some of those projects. What they're rolling out safety systems or being able to select the correct projects. As our budgets go down, we really need to be able to see which projects are effective and get folks to respond back. How are they doing on those projects and things like that. And then lastly is, how are leaders in the organization, beginning to manage or shift things and managing this crisis. So hopefully they're well on their way, right? But some organizations are a little behind the curve. So really the role of the leadership in these organizations and to really keep things functioning and transition, if you will, back to a restored new in this case, right? Not a new norm, I like to say, but really where are we going to go from here and pick up those challenges? We have an opportunity here. Ongoing healthcare system impacts, apart from the the same thing that's going on with COVID. At the same time, we have long-term systemic issues that are in the healthcare area. So you folks know this better than anybody. Processes might be heavy, laden with paperwork, or we haven't made the transition totally over into different digital areas. That's really what we're doing. And what comes of that? You're hearing numbers like, here you go, 81% of patients are unsatisfied with their healthcare experience. I had a great healthcare experience the other day. I was donating blood, which I've done so since the pandemic, and I encourage everybody that's listening to this, that's just something little that you can do that's personal and will help folks in your community on a day-to-day basis. Anyway, there was an app that they had, okay? I could set an appointment right on there. And not only can I set an appointment, but it also does a reminder. That's just one thing. But then it tracks where my actual donation is. Where is it in the process? Is it getting tested? Has it gone into storage? And the best thing that puts a huge smile on my face, it says it's being transferred, in this case, to a local hospital here in Boston. It brought a smile to my face. And those little things of getting your clients and your, in this case, patient, making me aware of what was going on there. Some other heuristics here about different breaches, data breaches are always, security is up more the forefront of everybody's digital transformation aspect to be there. And 41% of providers, it says here, really have challenges with getting different analytical data out there. So how can we do this? What can we provide in our area to get people to see different things and really see the impacts? We'll talk about it from a project perspective or maybe a work management perspective, but regardless of what solution or what aspect you're looking at today, just use a little checkbox and figure out, hey, how can we do this across this area? From a perspective in healthcare, Microsoft has shared some of these. We've calculated some of these scenarios themselves. On the left-hand side, I'll just pick a couple of areas here. On average, between I'd say 20 to 25% people, we give clinicians and the admin the ability to spend more time with these patients by cutting what they're actually doing, so they can focus on that patient set. That's really what we do. So enabling personalized care, give the data, give the time available to these resources so they can actually go ahead and concentrate on what they're doing. And it is the empowerment of these different care teams that help really connect what they're doing with the patient. Well, maybe you're not in the clinical side or the actual caregiver side, but you're on the back system, or you're doing with the IT in healthcare, or the different process, or different regulatory. All of this can hold true through your different organizations. And there's a couple of of these that go through here. But finally, being able to reimagine how healthcare can work, or how your organization can work, is really the starting point of your digital transformation, and being able to re-envision or transform that healthcare to grasp those opportunities and really build upon different avenues there. And Microsoft can bring all this together and deliver automation, right, and overall efficiency across the organization. And that's really going to bring high value to your decision making and what you're going to get out of really. So what you're doing is you're turning insight into action. And that's really the key here that we want to hear. Now, from a cloud-based solution, by moving everything off to the cloud, we can react quicker. You'll be able to, get out there. Now you can do different trials, and we'll talk about some of those. We'll show you some of these cloud tools that are out there, leading with Microsoft 365 and the project platform, but also Teams and using Planner and all these other good things. And there's also a solution that's been baked for you that is Healthcare Cloud. And just what we're going to show you is just a part of those. So it's going to enrich your overall experience. It's going to enrich your customers or your patients, depending on which avenue you're looking at, which side of the table you sit on, and that's really key. So all of this, that we're trying to do is we're really trying to get more with our folks that we currently have. As we reduce, different areas, we want to be able to increase more visibility and really help customers achieve. That's what we do in Microsoft, to help customers achieve their digital transformation. So if we need to move to an all electronic submission form, let's go ahead and see how we can actually do this and how does it work? What is the value to really? Trust is the most important thing that we're going to have here, especially around patient information. Anything to deal with patient information. You know, the highest level of commitments that we're seeing for trust and security, you know, with 1 billion invested annually in security around Microsoft, that is really where we're putting the money where the mouth is and making sure that we're detecting threats 24 by 7 hour security monitoring, whatever happens. We need to break this across a global scale, and that's what the cloud does. And then lastly is just, once we take that scale, we have compliance and security measures that are in there. So with over 40 years serving the healthcare industry and organization, our experts, you know, as you can imagine, we're in this day to day. And the biggest thing we see is within healthcare, where is and where are those digital feedback? So where is that information going to? You know, data, in your terms, data is the oxygen of everything in the healthcare organization. It keeps us going. It empowers us to make decisions, right? So we, from a patient perspective, we can get that information. We have customers that are bringing in, again, they have a nice user experience. If it's within an organization within your healthcare, you also have, you know, businesses to serve. How do we get them information? How do we get them the data they need to select or manage different pieces of this entwined puzzle that we're talking about? And as data is exploding, the massive amount of data that's out there, we need a very easy way to figure out how do we get access to that, and then how do we read through it, or how do we report on it. And you can be as you know, digitally advanced as you want to, and using things like Microsoft AI to scrape and look at some of that data that's being stored and captured for you, or you could take that first step, which is that visibility, providing a collaboration area where everybody can see and do. And that's what we're going to see today. But all of these parts that you're taking a look at across all of your organizations, your customers, your patients, all of the products or solutions that you're developing, they're all operational related. And that's the key here, is being able to provide a data feedback loop within each of these segments and being able to provide that in a very clear and easy way. Well, all of this, you know, what we're trying to do in this caregiver is to free up the time for a patient, right? So now we can focus on those. And how can we do some patient care advocacy and bring to the organization? Well, with Microsoft Project and Project Teams, along with Power Apps, you can go ahead and free up them and really use the tools to lessen the burden of paperwork, for maybe one example, to see the visibility of where our teams are working, who's available to work on what, right? If we have a request out there. Again, with the solution set, you can better help physicians to collaborate. If it's an intake form, which we'll see, you can actually have that area and then focus on the information that's coming in, make those decisions, send an automated response. If there's a workflow out there, again, a lot of automated solutions to reduce the amount of manual effort. Keep the focus for those folks, those clinicians, those frontline workers, whoever happens to be, to dealing with what they need to do. Our customers, our patients in this case. Now, as we go through here, the one advantage of all this is going to be it's interrelated. You have all of this information. And when you look at it from a perspective of how we get stuff or get work done, you know, that's really the key. So healthcare providers have begun using the different solutions, and one might be a Power App or Microsoft Project, or maybe even Teams, to go ahead and see across their organization. And we can go ahead and reduce the amount of overhead there is, or manual effort that needs to happen, because we have these digital solutions that are there. And it can grow into something much more than that, but we need to start somewhere, right? Then we can prioritize either the patient experience, or maybe we can prioritize a particular request or projects that are going out there and focus and shift our effort from one area to the next area, all because we can see this data and we have this information. And then the biggest thing, whether it's efficiency increase through automation, through visibility, through reporting, or through automated AI forms, you can get as detailed or as granular as you want to. Well, in the work area, and we're talking about this work and helping people, do this, is the first thing that you can do is get onto teams, and have these areas. What we're going to show you is project team areas that you can go in and request some different information or see that visibility across from the first piece all the way there. So if folks have this area and we're putting all this information in and maybe even recording meetings and doing this, we as an organization can then provide a better outcome to those clinicians, to those other folks. You can have a separate area for your frontline folks, your clinicians, your doctors, etc., that can use these different apps, that can use these different reports to see directly the data that they need, to drill into the patient record or whatever it happens to be directly from your secure area. And you can have those areas within teams. You might also just have regular tasks, and a lot of people pull over from Outlook. So all you Outlook to-do folks that are out there, we're going to show a way of how to take those to-do tasks as well as your project tasks that might be out there in any form, whether it's on a particular project, whether it's in regulatory or clinician, clinical, or any of those phases. Maybe you're doing new product development or drug therapy, whatever it happens to be. You can see everything within one area. You can also see that, for a planner view, and that's going to be a lighter weight task management area. I sort of pause there because it's more of a task visibility, and then we still need Project Online for the task management of all this, and that's really where you're going to be managing all these information, those pieces, and sending that data out to the organization. Just one, example. The other example there is, from an entire area, from the intake and using something like a CRM within Dynamics, or taking a revenue-based approach and being able to use project operations there to see the detail, the invoicing, whatever it happens to be. You can get all the way there. So we go from these group work or this, sort of individual directed work, we get into this formal managed work, and we start managing these projects. And then what we do is we take all of this and what we were just talking about, getting these cloud-based solutions, driving your digital transformation through the Microsoft Power Platform. So we have Microsoft 365 and all the applications and tool suite, and then we have Microsoft Power Platform, which is really going to be the needle and thread for your organization to sew the automation through. And these are low code, no code development opportunities across your organization. So we've had experiences of organization that a clinician just simply took it upon herself to start creating, or an area of a vendor, he took it upon himself to start, hey, wouldn't it be great if? Well, the tools are there and they're at your disposal. And that's really where we're trying to get. The last is, if you have other types of work out there, you have developers that are building these apps, you can pull that information in as well. So regardless of the methodology of your management of the different pieces that you're taking a look at, you can blend everything. Everything can be pulled in. Yes, you'll have different use cases per se, but it all can follow and can be all pulled in to the overall use of the tool. Now, we talked about 3 different areas, so I want to pull and sort of cover some of those. The number one is going to be project. You've seen some of this, but the lightweight area out there, it's very quick, very easy. This is where you're going to get your planned work in there, and you're really going to see some of these results. This is where you might say, oh man, project's just too complicated. Well, there's a very light and easy way to do this, and very quick. The other area is that collaboration, that hub for all of your work. That's Teams, the purple area. We use it every day. I really try to make sure that folks are aware of all the new things that come out, both in project and in teams. What we think is the best approach is having a project-based team approach. So when we get into the demonstration, you're going to see projects that are created within teams and how those happen. So we can collaborate across all of these different apps, across all of these different groups, irregardless of what your role happens to be, we can all work in one area. And then we mentioned that Power Platform in the other area, and that's really going to be, maybe Power Apps or something else that you're going to be building and bringing in. And those Power Apps that we have is really low code, no code. Probably have a sample of a Power App for you, so you can go ahead and take a look at those when we get there. But all this information is really where we are. So imagine, this world while you go through your digital transformation, that you can have all of these things integrated. In today's workspace, there are many demands, right, across the board for what we need to get our attention, right? Whether it's work, related or personal that's out there. So we have emails, we have chats, we have files that are being sent around, data that comes through that we might need to pull into a tool. A lot of folks, it's all right, use Excel and pull this information in. Well, as this stuff starts going, we can start to automate all these routines and really get into, accessing apps, whether it's a partner through us or, you create it internally. That's the bridge. And then the collaboration and communication. You can simply get your information all up into one area. And it's when you take all of these, that's when you're using a tool in a single area, and that tool is going to be Teams, and that's going to service everything. So one of the first things that we see across the healthcare industry is the adoption of Teams, or the trial of adopting Teams as that digital transformation component that really leads everything that we're just talking about and drives it into the area. So with that being said, let's get into the tool set. Let's start to take a look at Teams and figure out how we're actually going to do this in an environment. So for you folks that have Teams out there, you're actually able to go in and set some of this stuff up. And if you want, a replay of this, or you need a specific demo, just reach out to us at info@ppmworks.com. And while my screen, I'm just taking a look to make sure my screen is coming through so we can go ahead and see that area. Where we're going to start here is in Teams. All right. So let's walk through and how this is going to look for an organization like yourself. So the first thing that we talked about is getting one area for all of our things that are related. In this case, we're going to show you, how, to initiate a project, how to do that information, maybe how to automatically create a team from one of those projects. Would that be good? But we're going to focus first on this team. Then on the left-hand side are a list of all of our teams. And we have these potentially by project or group or initiative. And depending on what role we are within Microsoft M365, it brings us in, it lets us see what we can see. You can have security in here too. You can have private channels for only those folks that need to see some information on a particular project itself, or particular team itself. And in this case, we have a bunch of different samples that we're going to go through. Well, let's talk about that one sample here. So if we go in here and take a look at a new project request. So we're in here, project innovation, we called it, and we have a new project request in this case. This new project request could have different forms. So in this case, if it is, a new product development potentially, or maybe it happens to be an agile, you can go ahead and just simply select whatever it is. This is all configurable, folks. So whatever types of requests you have in, again, think about this on a tablet or maybe even a phone. We just have easy to click, off we go, we drill right into it, and we're going to create and start getting into the actual area to start filling things out. Now, in this case, you could have more of a tabular form where they fill out some information. Hey, I'm going to fill, my name, my description, project departments that comes in here. We can look all this up. All of this is looking through the organization. You can have this be a dynamic. So if you fill a particular task out, it might pre-populate others, or it might reduce the number of fields that you actually need to fill out. Regardless of how you do all this, very quick, we're capturing this data, we're getting into the system for us to be able to go ahead and take a look at all these proposals and be able to determine, is this the right project for us? And do we have the appropriate costs as well as resources to do that? Well, one quick area that you can do all this is you just simply see all this information in a list. And you can capture all of this information, and then we can go ahead and actually go in and take a few of these and promote them and say, hey, we want these to be the projects that we're going forward for. So again, we're taking a look at our projects, we're creating a new project request, we're able to see it in one area, and then we can go off. Now you can take the same technology, premise, and use a different technology. We talked about automating things and making it easier for folks. Well, in here, you can have an app that starts pulling in information. You can have anything from a splash screen here that says, hey, we're doing this, and welcome to this app. Let's get started. Whatever it happens to be, make it yours. Make it easy and user-friendly. In this case, we're taking a look at a bunch of those different requests. We just have it, here's that new Mach 8 printer or whatever happens to be in here, and we can see all this information. But if we take a look at how we look at a new project, in this case, we have some areas that we're dropping in. It can be using Active Directory to go ahead and look across the organization to see, things that are here. You can have different level of complexity. So in this case, do we have a high level of complexity, a low level of complexity? We have a bunch of information on the request. I'm not going to go ahead and fill all this out, but is this a patient safety or compliance request? Is it confidential, etc.? Whatever it has to be, you can walk through and fill out this information. You can have an automated project number be generated when the project is live. All of these things are really up your sleeve when it comes to configuration and deploying this. Now, I do need to save something here, so I'm going to call it growth, and there's a couple other things. Now, in a Teams creation, we pull this out so you can see how this is happening. Now, typically this would be automated. So depending on the template that you created, it's going to say, hey, yes, we're going to have a Teams, or maybe not, in that case. Well, in this case, we want to create a team, and rather than having standard, we're going to do the project team itself. And I'm going to go ahead and just save this out here. Whoops, nice. What do I need? Project name. That's good. So we're going to do a new floor renovation. What is this going to be? The East Wing blood donation. All right, whatever happens to be. You guys get the point. And go ahead and now I can go ahead and save this. So now that I save it, it's actually queued up. It's put into the process, and then it would run. Off it would go. It would create our new floor renovation project if we had that. But in this case, we have some approvals to do. So I'm going to go ahead and manually run this thing. But in this case, we could have approvals that are sitting out there, and I'm going to go ahead and run that. And while I do that, it's going to say, hey, what's the information? What am I looking at? And this is where you can have some information or some feedback in your organization. Now, some folks have this and it goes directly through and you don't need to hit any of these buttons. But for you, I just want to show you what's happening behind the scenes. It's actually running a flow. I'm manually doing this so you can see these steps. We're incorporating Power Apps. We're taking something called Power Automate. We're using it to create a project in Microsoft Project online. We're housing all of this in Teams, and the data is going to be stored up there. Well, there is a request that comes through. And what's the number one area? Outlook. All right. So folks like Outlook. Unlike me, I do not like Outlook, but here's an approval. You could have this approval be sent directly if you wanted um, to the solution. So I mean, to wherever it happens to be, to Teams or anywhere else you want. Well, in this case, if I open this up, I can go ahead and prove this. Do you have comments in here? Move ahead or move forward, whatever it happens to be. These are all capabilities that you can configure within the tool set. Now, while we go ahead and I'll go ahead and prove this now, at that point, it's going to go off and do what we told it to in the request. What did we tell it? We said, hey, you can go off and create a team. You can go off and do that, and you can do some other things, all right? So in my activity area, you can see right here, boom, and you can see it down here. MS Teams created a team for you, a new floor renovation. So it is going off and creating that team for me, and I get a warning here, a reminder as well. And if I go back to my team area here, I can scroll down, and on the bottom, whoops, there it is. Get rid of these hidden ones. On the bottom here, it has my new floor renovation, East Wing, all right? And now, depending on what I did and the complexity of it, it's going to start creating some channels. It's going to start creating some tabs for me, whatever that happens to be. So while that's working behind the scenes, I'm going to go back up here and take a look at one of these others that's already been created. So we created, in this case, a sample project across your organization, and we have some areas. So those are the ideas, but where is the schedule? Well, remember when we filled out a couple of those forms, there was different complexity. Well, in this case, maybe a high complexity is going to go off and create and use. Remember those icons that were there, those green icons that said agile, new product development, facilities, whatever it happens to be? What's tied to that? A schedule with maybe some resource information at a role-based level. So then the project manager can start to use some of this information and we can see it all. Now in this case, I want to show you, what is this? This is Project Online. Well, normally I would recommend that if you do a tab, we show it here, and we're going to show it just what the tab is looking for, in this case, the schedule. Okay, so we're taking a look at the schedule. The project manager can come in here and do all this information, whatever they want. Now, these are tasks that need to be done. We're talking about work management and getting things done, being more efficient. Yes, people can come into Project Online and update the baseline, do all this from a PM perspective. But what about the resources? What are they doing? I'm going to show you that in just a second. But from here, I'm going to go ahead and close that project out, and I'm going to go into maybe some reports we want to see in the project. Now, this is pulling on another technology out there. Again, all of this is embedded. It's seamless. We don't need to integrate anything for you as a solution provider. What we're doing is making sure that you have the knowledge, as well as we're connecting the data and we're pulling those processes in so you can become more efficient and you can do those across your organization. In this case, we're looking at how to become more efficient in creating project teams using those solutions. And here we can see a portfolio dashboard that's been created, and we can see some of this information. And if we take a look here, we have a milestone timeline that's here. I want to show you another sample of this as this comes up too, is here we go. So we have our portfolio dashboard, our timeline, analysis complete. But imagine these could be first patient in, last patient out, or regulatory, phase 1 trial, whatever it happens to be within your organization, whatever that department happens to be looking at, right? Because you might have a lot of different projects with a lot of different potential milestones or standards in your organization, and you can accommodate all those. And if we were to open up one of these particular projects here, you can see that we have our analysis complete here all the way through. So it's a very nice area that folks like to see, and this might strike a chord with you. You might have a tool or a process right now that you go off and you create Excel, or you're moving these bars, or maybe even PowerPoint, or One-Pager Pro, or something that's out there, and you're saying, man, this is so time consuming. Well, in this case, we're showing you right here, it's pulling the data directly from Microsoft Project Online. You don't need to do anything. You don't need to change it. You can, if you want to go forward and filter here, you can say, yep, I'm going to go ahead and take a look at, all projects, or just that ones that are in progress in this case. And again, we're going to filter everything out and see that data across the organization. If you are managing financial information, you can go ahead and do that as well. Again, all of this could be pulled from not only Microsoft tool sets. You could have something out in Oracle or SAP, whatever it happens to be, and we want to pull that information in. We can pull it into a grid like this, manipulate the data, or it can be directly implemented into one of your reports. Again, trying to get you to automate as much as you can so we can actually see that information. In this case, we're talking about financials across this area. Another area is meeting minutes and issues. If you're tracking things in your project and you're tracking, and taking notes, what's the best way to do? Boom, right here, OneNote. So you could have a OneNote template that takes meeting minutes. It could be anything within your organization. You could using the templates. Everything is seamless in here. This is OneNote now. So we're seeing OneNote within here. Again, we're in Teams, and we've just gone through 5 or 6 different technologies. And lastly is issues. This could be pulled directly from the project site. In this case, looks like we need to add more issues. Well, that's good. We don't have any. But if I was just to go ahead and add one, you can go ahead and see, how that looks. Floor leak on 13th, whatever it happens to be. Who do I want to assign it to? What category is there? Are there any descriptions? All of this can be configured to your organization and what you need, okay, here. It really is up to you. It can even have an attachment. So just a simple list. These can go directly related into your project as well. So we took a look at how we created the actual project from an innovation perspective, a new project request, and seeing that app. And then we also saw the list at the end, the new project request list. All of this information, again, is being pulled into our tool set. Well, we talked about a perspective of someone that's requesting a tool and for the process of creating this area and actually managing through Project Online. And if we were to look at one of those projects through Project Online, it's going to look pretty similar, right? We can actually go ahead and see some information on the left-hand side and do any approvals. We can see some of the data. But what if we want our team members, okay, again, those folks that aren't familiar with Project Online, what if they want to go off and just see some of this information in Teams, but in a list format? Well, what we do is with our tool, with our PPM Works sync tool, the planner, is we're taking these determined project, all these tasks, and we're saying, yes, we want to send it off to a tool called Planner. Okay, Planner is a lightweight task tool that's out there. And we're going to take these and actually sync these. In this case, we're going to have a bucket called scope, and we're actually going to bring this out to, what's the name of this project? Coho. So we're going to have Coho Health Scope and Coho Health Assessment as our plans out here. And if I go over to Planner, here we go. Coho Health Scope and Coho Health Analysis. So what am I doing? I'm taking those tasks from Microsoft Project and I'm pushing them over into Planner. So now team members that are on this plan, okay, can come in here, take a look at these tasks and say, yep, I either want to assign these tasks here to Megan or whoever happens to be. And then I also can take a look by adding a new bucket, backlog, scope, to do, or maybe I want to group these by assign to, in process, labels, priority, whatever happens to be. In this case, great way to prioritize something. Determine project scope. Yeah, I would say that's pretty urgent. We need to definitely do that. Secure project is definitely important. And then, all this other stuff is medium. Very easy, very drag and drop capability, right? Here's everything that's here. and we can even go ahead and create and enter a new task if we want. We could sync this information back to projects. So if we were to come in here and do completed or in progress, it's going to take that information as well as these fields that are out there and send that back over to our project manager or our scheduler that's over there on the back end. They can deal with all that. We don't need to go ahead and deal with that. So that's great. So now we have some areas and some information and some tasks coming back in. We talked about how we integrated project with planner. And where do we see all that? Well, over here are those same planner plans, and we're just in a team. So I go over to my planner tasks. This is going to look familiar, folks, right? Come back in here. Here are my 4 or 5 tasks that we just talked about right here in the center. I could definitely move things just like I did in the others. And then from a schedule perspective, we can go ahead and take a look at that schedule. We are going across different applications within Microsoft, but for a user, we're not feeling any pain. We are simply just clicking around, going from what we have set up in these project teams and what we want users to use and to see directly within our team. And then we take it a step further. The last step is saying, okay, so you showed us how to very easily create a project, very easily set up a team with team automation, okay? It also set up a project. We have some workflow. I'm getting benefit. I'm getting value of how easy this is going to be and quick. But from a user perspective, a team member, it looks like, I got a lot of teams here and I can have team proliferation. Yes, you can, but you can actually add the application called Planner. It's going to be renamed here. So if you're on a recording and you're looking for Planner, it might be called Tasks by the time you read this. In October 2020, it's still called Planner. And if I go ahead and open that, now if I take a look here, and you can see the banner up top here is talking that it's merging those two, and it's going to be called Tasks here. Isn't this brilliant? So now I get to see all of my tasks across all of those plans, which is the originating factor of this is Microsoft Project Online. These are Microsoft Project Online tasks that are being served up into Planner, and I'm seeing them here all within one. I also get to see things that I put on my Outlook to do. So for me, I can come in and take a look at things that are planned and sort by due date, do different things. Also assigned by me, it's going to go across all of those plans that I have and be able to take a look. If I was to complete a task here, determine project scope, I can literally click in here and say, yep, it's in progress. Regardless of where I take a look at that in progress, whether it's within this planner, whether it's within the plan itself, okay, or it's in Microsoft Project, it's all going to be tied together with this syncing of all the data. So really what we're trying to do here is provide a very easy, lightweight area for all projects, all information, all work, so you can answer the questions that you need to, providing those users that are out there the direct access to what they need. And we started this whole thing around the healthcare area. So you can now take this, whether it's internal processes that you're managing and working on here, or if you wanted to keep going and use some of this for external. Imagine an app where you're taking a different request, or you have an intake from a website, right, that has a bot or someone that's interacting with it, and you have a list of questions that's going to triage. Then it sends a note through Teams, okay, and tracks that information, says, hey, Samantha has this request and this information. Here, we scheduled a telemedicine with that person, or we scheduled a call or a visit with that person, giving the client or the customer, maybe even a patient, real-time interactive response. And that's what we're trying to do, make sure that we do that. All right, so we've been dancing around and seen a bunch of great information to this point. I did mention a few things. One of it was the fact that we do, as a gold partner, we are are able to offer some different and unique offerings that are out there. Some of them are around our workshops. In particular, the one that you just sort of saw took in Teams, it took in Power BI, it took in Power Apps, and we had projects. So it used all of these things. We can get started with your organization in any capacity. If you saw something that sparked your interest, or really you're saying, wow, gosh, it'd be great if we had something, reach out to us. We can be contacted at info@ppmworks.com. All right. We talked a little bit about ourselves, but not too much. For anywhere from training to services to working with you to supporting exactly what you have. That's what we are. We are specialty consultants. We listen to you, understand your organization, and then meet a solution and recommend 2 or 3 solutions, not just one, that's going to work for your organization. This is going to be, it is being recorded and it's up on YouTube. If you folks are listening from there, subscribe to our channel. Give us feedback. If there's another topic that you want to hear, let us know. And we'll go ahead and make sure that we do a webcast on that, or webinar. We have webinars out here that are 5 minutes long. We have this one that's a little longer because there was a lot to cover. So again, totally up to you. We are certified here and we are part of the PMI, Registered Education Provider. So for the meantime, we are able to give PDUs for our contact classes here. So this session itself, you can grab a PDU, reach out to us, info@ppmworks.com. We'll give you that information. So if you're like me, you had a great day, you got some value out of it, where do you go from next? We can help you introduce you to your local Microsoft representatives if you need to, and talk about licensing, talk about workshops. Is there any funding to see if you can bring PPM Works in for you? There are free trials on our website you can go out and take a look at. We have sponsored workshops that I just mentioned. Microsoft sponsors these. They are limited, so if you're in the market for one, or really said, hey, we should get started, do it sooner rather than later, because some of those marketing funds will dry up as the year goes along. And then if you want a demonstration, a little bit more in depth, a little slower pace potentially, or with some of your realistic data, obviously triaged and a little scrubbed, but we can go ahead and do that for you too. And lastly, our YouTube channel. Check us out there. We're always posting different things out, different recordings and webinar sessions that are out there. I invite you not only to link into me, Jacques Goupil, but also to PPM Works to get a pulse on what we're doing today. All of our information is right there. I'll say one more thing with info@ppmworks.com for email. If you have any questions on behalf of Microsoft, PPM Works, and all of us here at our organization, we want to thank you for taking the time and joining us today. We look forward to seeing you on our next webinar series, which will be next week. And we, along with the rest of the organization, wish you a safe and very happy rest of the week. Thanks very much. Have a great day.